Olive is going to talk about some really exciting work by volunteers in the CRAC team.
Hey, Andrea, can you hear me?
Yes.
All right, very good. So this is going to be a little bit of an unusual talk for me. First of all, thanks, Andrea, and to everyone who puts together this incredible forum. I'm used to giving kind of data-rich talks on pancreatic ductal adenocarcinoma. I'm a translational scientist, and what that means to me is that I spend a lot of time putting together kind of multidisciplinary teams of individuals with really diverse expertise to focus deeply on hard problems of urgent need. And so by that metric, this is past couple of weeks of work with CRAC teams has been an extension of my day job. About a month ago, like everyone else, my research lab was drawn down, began to think about what it was that my group could do to contribute to the effort and to also stay active, working from home or mouse models laboratory. We can't bring the mice home with us. I think I shared a sense of urgency with many people, particularly hundreds and probably at this point, thousands of graduate students, postdoctoral fellows, staff scientists, administrative staff members, to try and contribute, particularly in support of our clinical colleagues who are on the front lines. And so, you know, there was this kind of urge, I think, to find a way to use our pipetting skills for good if we could. And, you know, the volunteer effort has, I think, extended in scope much beyond the idea of pipetting, but that's still part of our mission. I do want to mention that there are other organizations besides CRAC teams at Columbia University that are working in a volunteer capacity on the pandemic response, and two in particular that I wanted to mention are the COVID-19 Student Service Corps, CSSC. Our contact there is Sarah Suhu. This is largely comprises medical students, a large number of them, 1,400 plus student volunteers, over 20 active projects. I want to highlight that they've set up a childcare match service, particularly in support of healthcare providers. You should check out their website if that's something that's important for you. And also our colleagues at the Zuckerman Institute on the, more on the biomedical engineering side, Rick, Leslie, Tanya, Darcy put together basically a factory in the lobby of the Zuckerman Institute to start 3D printing face shields and other medical devices. Elizabeth Hillman has convened these expert panels to focus on important questions that need a consensus voice from the community, from a community of experts, and they've just been incredibly active. So we're just one more organization in a sea of response in the Columbia community. The history here is that a day after the research ramped down, Alvaro Cuesta Dominguez, who's an associate research scientist, started asking a lot of questions, and one of the about how it could be helpful. One of the things that he did early on that I think is reflected in our ethos in perpetuity is to focus on interfacing with Columbia administrators as part of this effort. And so he reached out to Mike Shalansky, he reached out to Erica Peterson, the head of the Office of Postdoctoral Affairs. They were supportive of setting up a volunteer organization, and Alvaro and Erica distributed an online form to get people to sign up who might be interested. That was on the 18th. 2 days later, they had 150 respondents. And you can see the number of members over time that has continued to scale. As of 3 o'clock this morning, when I finished putting together this presentation, it was just shy of 700 members who have signed up. And 150 of those have been actively deployed on site to volunteer, or as or off site, from home as officers and managers of the organization. And so the goals of the organization are to interface with existing Columbia administration experts and basically serve as a matching service. If you think about it, under normal operating circumstances, there are all these different units around Columbia that have 1 or 2 or 3 individuals who carry out a function and that's suitable to normal operating needs. But then in the context of a pandemic, the whole deck gets shuffled, and now they really have a job that's 10 times as big, and they still have the same number of staff. And then meanwhile, there's all these groups of really smart, really motivated individuals who are not able to go into their laboratories or do their kind of daily science. And so the question is, can we match those different groups of individuals. What we don't do is set up our own research projects or our own efforts. We interface with existing experts and administrators at Columbia. The goal here is to carry out volunteer activities safely and with appropriate oversight, and always to be a contribution to the effort as opposed to a distraction. So very quickly, within the first week, we put together an officer structure, administrative structure for the group. This is a subset of all the people that are working on this effort, but I want to particularly highlight Natalie Steineman and Miles Richardson, who from day 2 have really been in the trenches and helping to make this whole effort flow smoothly. We have a project development committee that helps us figure out what projects should get implemented and come up with ideas and source them from the public as well. And then every aspect of an administrative organization. So we have social media managers and personnel managers, and we have a safety manager who set up a check-in, check-out system so that we can do contact tracing for every one of our members if they're deployed in person. And then I really do also need to highlight the incredible efforts of Eric Greene and Sam Sternberg, to the other two faculty advisors on this effort, who have been just incredible in their enthusiasm and their energy in helping me to organize this group. The projects that get launched come to us either as requests from administrators or ideas from our people, our volunteers on the ground or through our website, or our own ideas from the active officers. And they really fall into 4 groups: data management, logistics and support, clinical projects, and research projects. And I'll give you a few examples of each of those. The data management projects have, by and large, been led by Howie Wu, who's an incredible epidemiologist with and database and data cleaning wizard. And he has assembled a large team of folks to assist with a project to assist the IRB with data management in the context of the high demand during the pandemic. And as well, in particular, this COVID-19 Directory, which is going live apparently on Friday. They've been, there were a large number of efforts to begin to put together databases of activities at Columbia that are focused on COVID-19. Eventually a working group under the guidance of Mike Schlansky and the RLLC committee kind of consolidated all those efforts. And a week ago, they asked Howie to pull the trigger and start designing a database structure with a web interface that's going to be public and easily accessible to all members of the community, to try to stitch together all of the different resources and activities on COVID-19 at Columbia. We also have logistics and support projects, and I think the most obvious one is this effort right here. So the group that supports Andrea in putting together this symposium, Kelly, Jesse, Esther, the whole set of volunteers helping provide logistical administrative support, maintain the mailing list, publicity, announcements, speaker requests, Zoom webinars. And I now have gotten to experience firsthand as a speaker how incredibly efficient they are at putting together this symposium. We also have efforts on mask reutilization, so focused on finding ways to inactivate SARS-CoV-2 viral particles on previously utilized N95 masks using, well, originally we were looking at UV sterilization, but more recently I think the focus has been on heat inactivation. And also a rapid response team that we put together in response to a request from John Smeridan in the EVPR, run by Fei Song. And this is really responding to the fact that there are very few people in the laboratories, and if a piece of equipment fails, it's much more harder to find someone who can help manage the situation. And so we have a rapid kind of on-call team to respond to instrument failures around the campus. And I should mention the manager of the mask reutilization effort is Anna Pinaranda. Clinical projects. These are so far non-patient facing volunteer efforts to support New York Presbyterian hospitals. We set up, this is our largest effort, over 100 shifts covered to date by more than 50 volunteers. I think those numbers might be slightly out of date. At least we're aiming for 2 volunteers per shift.
And 1 minute mark.
3 shifts per day, 7 days a week, 4 hospitals around the city. And that's in coordination with Terry Putchley from New York Presbyterian. We have more a serological testing effort working with Eldad Hode, scaling up the assay developed by Filippo Mancia. And this is just getting off the ground right now. The goal is to be able to deploy thousands of tests per day. And they're scaling to that effort right now. A very active project has been the Biobank, which is led by Alvaro Cuesta Dominguez, also under Eldad Hode. And this has now processed thousands of serum, plasma, and buffy coat samples through the Biobank that will be available for the research community. This has been a massive effort by everyone involved. And then coming soon, some more research projects focused on longitudinal viral load assessment that I'm actually going to be launching in my lab in collaboration with an anesthesiologist, Mark Heath, who is running one of the critical care units over at New York Presbyterian, and also a project on transplant patient outcomes and COVID-19 led by Elizabeth Verna. And this is a large consortium across 20 institutions. And our involvement is to build a REDCap database to manage the clinical trial data on a very short time scale. And so just to acknowledge, this is a tremendously insufficient slide, but certainly a large number of administrators at CUIMC, at New York Presbyterian Hospital, the faculty co-advisors with me, all the doctors, nurses, and caregivers who are taking care of patients, are nearly 700 incredible volunteers, and some businesses that have actually donated services to our group as well.
Ken, thank you so much. This is an extraordinary effort and really variegated one in terms of addressing so many distinct needs. We're all profoundly near debt. I see a question from Elizabeth Shane. Let me allow her to talk. Go ahead, Elizabeth.
Hi, thank you very much. I just wanted to say a word about medical students volunteering for research projects. We have students in all years who have volunteered. The CSSC is one area in which they have volunteered, but we're trying to keep a handle on their efforts in terms of research, and also, of course, to try and provide them with a learning opportunity to be on the front lines of an amazing research effort that the university and the medical school has pivoted towards in a very short time. So if you have projects where you need students, first, second, third year senior students to assist, most of them have the ability to, if they don't already have access to the EMR, they can get it relatively quickly through our office. And if you would just send me an email, I would be happy to do the best I can to get volunteers. I mean, really, I can email the classes with a description of the projects where you need assistance. And the response has been really amazing. I think George Hripsack can attest to that with one of his projects, Matt Baldwin, and the students are very, very grateful to have the opportunity to contribute at a time when they are pretty much barred from patient-facing activities and lab activities. So I'd be happy to help in any way I can.
Yeah, I've been absolutely blown away by the impassioned response of students and all scientists who've reached out to us. Everybody really wants to be deployed. There are some limitations. We've worked very closely with ISSO to deal with understanding the visa limitations. I encourage anyone who does want to become involved to reach out to ISSO if you're a visa holder to get guidance there. There are some limitations as well, as you suggested, to what students can also do. So we can help advise on that, or otherwise connect you to the appropriate administrators.
Great. Margaret?
Oh, hi. Thank you for this effort. I just was wondering, have you given any thought to, or would you consider reaching out to graduate students who are in the arts and sciences and working in the humanities to think about some of the socio-political issues that are coming up around COVID-19. The work that is being done certainly is fantastic, but it might be interesting collaboration and to add to it to invite graduate students in and give them an opportunity to think about some of these issues?
Yeah, I would love to make some inroads into extending the reach of the organization into other domains across the Columbia campus. Obviously, I think it's gone by word of mouth and then by distribution lists for our sign up. And so the more, the more we can advertise this and get this out there, I think the more we'll have the ability to bring on kind of more projects that extend across these domains. And so we do have a component on our website that allows people to submit project ideas that can then be discussed by the project development team. I would love to get someone from the humanities and social sciences to be part of that project development team so that they can help champion some of these other efforts. We've worked very hard to get engineers and medically oriented individuals and basic scientists and others, but it would be great to build that out even more.
Okay, well, let us know what you need, and maybe we can help.
Great, thank you so much.
Okay.
That's wonderful. So Ken, I think this can be summarized as never underestimate the power of a bunch of students and postdocs who are kept away from their labs.
Oh yeah.